understand Ukraine. I would like to give a short brief before the presentation, as probably all of you know that February 24, 2022, Russia started a full-scale war in an attempt to invade Ukraine. And sure, immediately at the beginning of the war, all of us, either private or government hospitals, were converted into trauma center, and we worked as trauma centers. But let's say in about 1 month's time, when managed to keep Russians out of Kiev and back to the north, to Belarus, we got the official permission from the government to start our routine practice, and so we restarted our practice. And in a very short time we realized that something is different with our laser vision correction. So we're operating with different patients, and we're doing a bit different surgery. So with time we decided, okay, we have to got figures, not just the impressions. So, and we compared two groups of the patients whom we operated one year before the beginning of war and 1 year after the beginning of war. And with this first realization is that, yes, we have about quarter of drop of amount of the patients, which is very understandable. But what's really interesting that if you can see the comparison between the group of the patients who applied and who did laser vision surgery before the beginning of war and after, they're absolutely different. The prevalence of females was 70% before the beginning of war, and 1 year after the beginning of war, we have the number of male patients has doubled from 30% to 65%. So more than this, the ratio between laser, LASIK and surface ablation changed absolutely. Before, in the beginning of war, we always had the good number of surface ablation, but it was less than 30%. But after the beginning of war, you see the more than 80% of our ablations are surface-based ablations. If to compare the surface versus LASIK-based ablations with the male and female groups, you see that after the beginning of war, here you can see nearly 100% of our males, they choose surface ablation. And I would say that those 7% LASIK that we did, it was our recommendations because there are patients with high astigmatism and high hyperopic treatment, and they don't like to do surface ablation for high hyperopics. So what's most interesting is that even female patients, majority of them now are choosing the surface ablation instead of LASIK. So the conclusions we were getting that the considerations of the patients to get laser vision correction at the time of extreme condition of war and in I would say normal urban life is absolutely different. And now the idea of the safety of getting after the laser correction, getting stronger cornea, thicker cornea, prevails to the fear of post-operative discomfort or post-operative pain and longer rehabilitation. And more than this, the most interesting for me is that the understanding of the safety of good vision when you're opening your eyes and immediately you're getting your best vision. You're not looking for glasses, or you have to take time to put on your contacts. In extreme conditions, this is the biggest privilege of the laser vision correction. And I would like to show you both of our sons are in military service now. The older one is a doctor, he is in the hospital, and the younger one, he was a medical student, but he left to join the military first 24 hours of the beginning of the war, and he's paramedic, and at the center you can see him, and his unit is around because it's a special unit, so he covered the faces of his friends. So thank you very much.